Ever feel kind of helpless? Watching someone you care about struggling with a really serious illness. It's rough, isn't it? You just want to do anything at all to ease their pain. And I don't just mean the physical pain, but like the emotional stuff too, the spiritual weight of it all.
Yeah, it's tough to watch.
Well, today we're going deep on something that gets at the heart of that desire to comfort someone completely. We're talking palliative care.
Exactly. And this deep dive, you're going to find this one especially good, I think.
Before we get too far, though, got to give a shout out to London Heartbeat Z Academy over in the UK. They're backing us up with some awesome educational support, over 150 courses they've got, popular courses too, all sorts of topics.
Wow, that's a lot.
And they keep adding more. So everybody listening, hit up their Facebook, Instagram, Spotify, YouTube. They're on all of them. You'll get free updates, stay in the loop, never miss another awesome discussion like this.
Yeah.
Starts off with this story. It's about a tree and a boy.
Yeah, right off the bat.
The giving tree, right?
Mm-hmm.
Such a good metaphor for what palliative care is all about.
Powerful. Really powerful. So the tree, it gives everything to this boy. Shade, fruit, branches to build stuff. And as the boy gets older, he keeps taking from the tree, always thinking about himself.
And the tree, just like someone providing palliative care, gives and gives, never hesitates, always puts the boy's well-being first.
Exactly. Even when the boy, now he's an old man, comes back to the tree with nothing left to give, the tree says, hey, here's my stump, come rest. It's like, it's the perfect picture of what palliative care is. It's not about curing, it's about comfort, it's about support, no matter what's going on.
Powerful reminder that sometimes the best thing we can do is just be there, offer comfort, be present.
Yeah.
Okay, before we go any further, let's define palliative care. It's one of those terms that gets thrown around, but people don't always get it,
Oh, yeah, for sure. A lot of people think it's just end-of-life care, but it's way bigger than that.
Exactly.
Palliative care is all about making life better, improving quality of life for anyone dealing with a serious illness. It doesn't matter what the prognosis is.
Right, so it's not about giving up or stopping treatment. It's about adding another layer of support, right?
Yeah.
One that focuses on well-being.
Totally. It works right alongside those curative treatments. Or, if there aren't really any curative options left, it can be the main focus.
I see.
The word palliate itself, it means to, take the edge off something. Lessen how bad it is without actually getting rid of the cause.
Okay, that makes sense. So easing the symptoms, providing comfort, helping people live their best lives possible, no matter what they're facing.
Exactly. And that brings us to a huge idea in palliative care, quality of life. And Dr. Riaz, he makes it clear it's not just about, physical health.
Right.
It's the whole package, emotional well-being, social, spiritual, and it's totally subjective. What matters is how the individual sees it, not some medical measurement.
Yeah, makes sense.
Yeah.
Two people with the same illness, their quality of life could be completely different. Depends on their values, what they prioritize, how they view their situation.
Absolutely. And this is where it gets really interesting. Dr. Riaz talks about this gap that happens. It's between a person's reality and their expectations. So imagine you're hit with a serious illness. Your expectations for the future, they change, right?
Yeah, of course.
Yeah.
I mean, you might have to adjust your hopes, your dreams, rethink your priorities, come to terms with limitations you didn't see coming.
Exactly. And that gap between how things are and how you thought they'd be, that can cause so much distress. And palliative care, it's like a bridge across that gap. It helps people adjust those expectations, find meaning in their new normal, make the most of the time they have.
Powerful way to look at it. It's not about pretending the gap isn't there. It's about helping people navigate it with, grace and strength.
Precisely. And get this, Dr. Riaz even suggests that focusing on others through acts of kindness, altruism, that can actually make someone's quality of life feel higher, even when they're dealing with serious illness.
That really resonates with me. Reminds me of that quote. The best way to find yourself is to lose yourself in the service of others.
That's a good one.
Like, even when you're going through tough times, finding ways to give back can bring purpose.
Yeah.
Fulfillment.
Absolutely. Okay, so let's shift gears a bit. Let's talk about the sheer range of issues that palliative care tackles, I mean, obviously there's managing physical symptoms like pain, but it goes so much deeper than that.
Right. He talks about understanding the patient's awareness needs, preserving their dignity, empowering them to make decisions, and then there's tending to their social, spiritual, and emotional needs. It's a lot.
It is. It's comprehensive. And to guide this approach, Dr. Riaz lays out these key principles of palliative care. And he starts with, like, a caring attitude. This means approaching each person with empathy, with compassion, genuinely trying to understand what their needs are, what their experiences are. Each person's unique.
Yeah, that human connection, that's got to be so important, especially when you're dealing with something as, sensitive and complicated as serious illness.
It really is. He also talks about respecting individuality and taking
Mm.
cultural considerations into account.
But
This means recognizing that how each person experiences illness is shaped by, like, their background, their beliefs, their values, their preferences. You can't have a one-size-fits-all approach to care.
Gotcha. So tailor the care to the individual.
Right. And that includes ensuring informed consent. The patient needs to fully understand their diagnosis, what treatment options are out there, the potential benefits and risks of each choice. It's their right to make decisions about their care based on their own values, their own priorities.
That sense of control, that agency, that's got to be empowering, especially when you're in a situation that can feel so overwhelming.
It is. And Dr. Riaz, he also points out how important it is to offer choices about where care takes place, whether it's at home, in a hospital, or in a specialized palliative care facility.
So recognizing that there's no right answer,
Yeah.
right? The best place for care depends on what the individual needs, what they prefer.
Absolutely. And he stresses the importance of, open and honest communication, appropriate treatment, and a really comprehensive approach. We're talking a whole team of healthcare professionals working together.
Communication really seems to be key here.
It's crucial. He emphasizes that there needs to be clear, compassionate communication between the patient, their family, and the healthcare team. That means being honest about the diagnosis, about the prognosis, being sensitive when delivering tough news, and being willing to answer any questions openly and honestly.
That kind of transparency, that openness, it's got to build trust, create a much more supportive environment for everyone.
Absolutely. Now, let's get into the nitty-gritty of what palliative care actually provides. The support services.
Yeah, I'd love to hear more about that. I mean, from what we've talked about so far, it sounds like palliative care covers a wide range of services. What's the practical support that's provided?
Well, in the presentation, he talks about pain and symptom management being like the main services.
Mm.
With pain, healthcare professionals, they work directly with patients and families to figure out, where the pain's coming from and how to give them relief.
Okay, and what about managing other symptoms? What kind of symptoms are we talking about here?
Oh, palliative care teams, they address all sorts of things that can really impact quality of life. Nausea, weakness, problems with bowel and bladder function, confusion, fatigue, and difficulty breathing. It's a long list.
Wow. So it's about easing those burdens, making
Mhm.
them more comfortable,
Mhm.
addressing the whole spectrum of challenges that come along with serious illness.
Exactly. Now, to get into the details, the presentation dives into how to manage 4 specific symptoms: delirium, anorexic cachexia, pain, and then he touches on some others briefly, like agitation, anxiety, depression, constipation, shortness of breath, fatigue, and managing secretions.
Okay, let's start with delirium. What can you tell me about that?
So delirium, it's a serious issue, especially in those final days for a lot of terminally ill patients.
Nice.
We're talking like a disturbance in consciousness and cognition, and it develops really fast.
What are some of the signs? If someone's experiencing delirium, what does that look like?
Well, they might have trouble paying attention, they could become agitated or withdrawn, have like perceptual disturbances, and their sleep-wake cycle can get all messed up. But it's important to remember that delirium is usually a symptom of some other medical condition, so something else is going on.
So finding out the cause, that's got to be essential to treating it effectively, right?
Absolutely. The causes, we could be talking medications, brain tumors, problems with metabolism, organ failure, dehydration, infections, low oxygen levels, fecal impaction, trouble urinating. Even just being in an unfamiliar environment can trigger it.
Wow, that's a lot of potential causes.
Yeah.
So how do they, healthcare professionals, how do they actually assess for delirium?
Well, a big part of it is knowing the patient well, understanding their baseline behavior, and noticing any sudden changes.
Right.
And then you've got a thorough medication review, a physical exam, and a real focus on identifying and treating any causes that can be reversed.
Okay, so once delirium is identified, how do you treat it?
The main focus is always on treating that underlying cause if possible.
Makes sense.
But controlling the symptoms is important too. Sometimes medications are used, like neuroleptics or benzodiazepines, but those have to be used very carefully.
What about non-medication approaches? Is there anything that can be done to help manage delirium without resorting to drugs?
Oh yeah, definitely. Things like avoiding overstimulation, creating a calm and familiar environment, making sure there's proper lighting,
Mhm.
providing like orientation cues, having clocks and calendars they can see, having a familiar face at their bedside.
Right, familiar surroundings.
Exactly, and minimizing anything that could cause a fall. All of that is important to consider.
So it's about creating that sense of safety, of familiarity.
Exactly. What are your thoughts on all this so far?
It's fascinating how many different factors can contribute to delirium, and it really highlights the importance of a holistic approach, both in assessing and in treating it.
Absolutely. All right, let's move on to the next symptom. Anorexia cachexia. This is basically progressive weight loss, breakdown of fat and muscle, and a serious loss of appetite. It's really common in older adults.
What causes it?
Well, the causes are all over the map. We could be talking physical factors like immune responses, tumor byproducts, changes in how things taste, dry mouth, mouth sores, nausea, constipation. Even emotional factors like depression and pain can play a role.
Wow, that's a wide
It
range.
really is. And Dr. Riaz, he's really clear that the first step is to try and find any reversible causes and treat those.
Okay.
So that might mean addressing things like dry mouth, oral yeast infections, acid reflux, nausea, vomiting, constipation, pain, and depression.
So address the root cause whenever you can.
Right. Dietary changes can also be helpful, like getting the patient involved in planning the menu, offering small portions of foods they enjoy, avoiding strong odors, and focusing on things that are easy to swallow.
So making the meals appealing and accessible to the patient.
Exactly. Now, medications are sometimes used, but Dr. Riaz, he's got this caveat. He says nothing really works for very long, all meds have side effects, and they tend to only work for short periods of time.
So medication isn't a cure-all, and you have to weigh the potential downsides carefully.
Definitely. And along with medical interventions, patient education is a big part of it. Helping patients understand that anorexia cachexia, it's often just a part of the illness. It's not that they're starving, that forcing food can cause discomfort, and that artificial feeding usually isn't beneficial. That can really ease their anxiety and help them accept what's happening.
So focus on comfort, not forcing interventions that might not be helpful or even wanted.
Exactly. The body can actually function pretty comfortably on very little food, especially towards the end of life.
It's a good point. You know, it makes me wonder, do you think our culture's obsession with food and eating sometimes makes it harder to accept anorexia cachexia as a natural part of the dying process?
That's a great question. And yeah, I think there's something to that. We associate food with caring, with love. And it can be tough to let go of that, even when it's not in the person's best interest anymore.
Like, we need to redefine what nourishment means at the end of life. Maybe it becomes more about emotional and spiritual sustenance, not just calories and nutrients.
That's a beautiful way to put it. All right, so let's talk about another symptom, pain. A very common one, and it's really tough to deal with. It's something that palliative care addresses head on.
Pain is something that I think most people have experienced on some level, even if they haven't dealt with it in the context of a serious illness.
You're right, pain is incredibly common, and Dr. Riaz points out that it's a major issue for both cancer and non-cancer patients. A huge percentage of people experience significant pain in their final months of life.
So what are the most common things that cause pain, particularly in older adults?
Arthritis is the biggest culprit. Then you have old fractures, issues with prosthetic joints, neuropathy, cancer-related pain, and then a whole host of other causes.
It's amazing how many potential sources of pain there are, especially as we get older.
It really is. And Dr. Riaz stresses that pain is multidimensional, emphasizing that it's what the patient says it is, their experience. It's not just the physical sensation, but how it affects their overall well-being, their mood, how they function, how they interact with people they love.
So you need a complete understanding of the patient to address their pain effectively. Not just their physical condition, but their whole experience.
Right. And sadly, even though pain is so common, it's often not assessed or treated properly.
Why is that?
Well, there are roadblocks at every level. Patients might be hesitant to mention pain, families might downplay it, staff might not be trained well enough, and even doctors might not be comfortable prescribing the right kind of pain relief.
So how do you get past those roadblocks and make sure pain is managed properly?
Dr. Riaz, he lays out some important guidelines. The most important thing is regular assessments and relying on the patient's own description of their pain whenever possible. This might involve using pain scales like numeric scales, color scales, visual analog scales, or even charts with facial expressions.
What if the patient can't tell you how much pain they're in? If they can't communicate verbally.
That's when those behavioral tools become super important. Watching their breathing, how they're acting, their body language, the sounds they make, whether they can be comforted, all of that can tell you a lot.
So you have to be very tuned into those nonverbal cues, really understand how that individual expresses discomfort.
Exactly. Now, once the pain level is figured out, medication is a big consideration. Dr. Riaz is a big advocate for scheduling pain medications regularly instead of just giving them as needed. This keeps the pain relief consistent and prevents it from breaking through.
So be proactive, not reactive.
Exactly. And he recommends using opioids more often when it's appropriate, especially for moderate to severe pain.
Okay.
Of course, you have to be very careful with opioids, monitor them closely, and manage any side effects.
Opioids are a tricky topic, so you have to be cautious and understand both the benefits and the risks.
Absolutely. And unfortunately, there are lots of barriers to treating pain effectively. Fear of addiction, the stigma around opioid use, even fear of the medications themselves. And these fears can exist in patients, family, staff, even doctors. So pain gets underreported and undertreated.
It's really sad that those fears can prevent people from getting the relief they desperately need.
It is. And that's why education and open communication are so important. Now, beyond medication, Dr. Riaz emphasizes how important non-drug approaches to pain management are. He calls this a hand to hold, a heart to touch. It's about comfort, connection, reminding the patient that they're not alone.
That's beautiful. It really emphasizes the human element that's so central to palliative care. What are some examples of those non-drug approaches?
Sensory stimulation can be really effective, like showing patients picture books, playing calming music, using aromatherapy, offering things to touch or massage, even something sweet to taste. It's about engaging the senses and creating a soothing, positive experience.
So you tailor the approach to the individual's preferences.
Exactly. Other options include exercise programs, acupuncture, TTNS, and relaxation techniques like guided imagery.
So it's like a whole toolkit of different approaches. You use them alongside medication to provide really well-rounded pain relief.
Exactly. And it's important to remember the goals of palliative care go way beyond just managing those individual symptoms.
What are those broader goals?
Dr. Riaz, he highlights a few: eliminating or reducing discomfort, improving quality of life and mood, lessening fatigue, and of course, reducing pain. It's all about taking care of the whole person, not just their illness.
It's that holistic approach again.
Yes. And to reach those goals, you need good communication. Before we get into that, though, I'm curious, what are your thoughts on that balance between using medications and not using them for pain management?
That's a really interesting question. I think it really speaks to how individualized palliative care has to be. You can't just give someone a pill and expect everything to be fixed. It takes a combination of approaches and really understanding what that person needs and prefers to provide truly holistic care.
I agree 100%. It's about recognizing that pain is complex, it has many layers, and you need a multifaceted approach to address it.
Exactly. Okay, so let's talk about communication. What does good communication look like in palliative care?
Well, it means being honest, being willing to talk about dying openly and compassionately, delivering bad news with sensitivity, encouraging people to ask questions, and helping patients understand their options and make informed choices that match their goals.
So it's about creating that space for open and honest conversation, a space where patients and families feel supported and empowered to make choices that reflect their values and what's important to them.
Yes, exactly. And those choices, they often center around what we call goals of care. And Dr. Riaz, he makes it clear that these goals should be specific to the patient, realistic, related to how long they're expected to live, determined by where they're receiving care, and most importantly, driven by the patient themselves.
So it's about shifting the focus. It's not just about extending life for as long as possible. It's about making sure the time that's left is lived as fully and comfortably as possible, and that it aligns with the patient's wishes.
Exactly. And that brings us to the question of what palliative care actually offers to the patient and their family. What are the concrete benefits?
Well, for the patient, palliative care can help them feel stronger, more at peace, so they can continue with their daily life. It can make it easier for them to tolerate medical treatments, help them understand their options better, and give them the power to live their life to the fullest, even with serious illness.
And what about the family? How does palliative care help them?
It gives them understanding, guidance, helps them deal with the emotional roller coaster that comes with serious illness, offers support while they care for their loved one. It can also lighten the load of caregiving and create a more peaceful, supportive environment for everyone involved.
So it's not just the patient, it's the whole support system. It recognizes how emotionally and practically challenging this is for families.
Absolutely. Okay, before we wrap up this part of our deep dive, I think we need to touch on that idea of transformation that Dr. Riaz brings up at the end of his presentation.
Right, right. He calls on his audience to change their lives and embrace these 5 L's of transformation. I'm really curious to hear your thoughts on this. What do you think these 5 L's stand for? And how can we apply them to our own lives, even if we're not dealing with a serious illness ourselves?
That's a great question, and I think it's the perfect segue into the next part of our deep dive. We've covered a lot in this first part, exploring the principles of palliative care, the different services it offers, and how important good communication is. But there's so much more to uncover, especially when it comes to those 5 L's of transformation. I'm looking forward to getting into that. But before we move on, I want to encourage our listeners to think about what we've discussed today. What really stood out to you? What new insights did you gain? How might understanding palliative care better change how you approach caring for yourself or your loved ones?
Those are great questions to ponder. And we'll pick up right where we left off in the next part of our deep dive. We'll explore those 5 L's and how they can guide us towards a more meaningful and fulfilling life. So we're back, diving deep into palliative care. And it's really something how Dr. Riaz uses that story, the giving tree, right in the beginning of his presentation. It's not just some kid's story. It's like this profound metaphor for the selflessness at the core of palliative care.
Yeah, it really is. The tree gives and never asks for anything back, just like the people who dedicate their lives to providing this kind of care.
Exactly. And that spirit of giving, I think that's really what we're talking about here. It goes beyond just treating the illness. It's about caring for the whole person, their physical needs, emotional, social, spiritual, all of it.
And as we were talking about before, that holistic approach, it really needs open and honest communication to work. Dr. Riaz really hammers that home, doesn't he?
He does, yeah. He says effective communication is absolutely crucial in palliative care. And he actually lays out a few key things that make for that kind of communication.
What do you think is the most important part of that?
I'd say honesty is at the top of the list. Being honest with the patient about their diagnosis, about their prognosis, about what different treatments might do for them, the good and the bad. It's not about avoiding hard conversations or trying to sugarcoat things. It's about making space for real, open, and honest talk, where patients and families can feel like they have the information they need to make decisions that align with their values.
It's about respecting their right to make their own choices, giving them the information they need to make choices that feel right for them.
Exactly. But that honesty, it has to go hand in hand with compassion. Delivering difficult news in a way that's sensitive, empathetic, recognizing that the information you're sharing has a real emotional impact.
It's about being there with the person, not just giving them facts, but really understanding what they're feeling and supporting them through it.
Right. And another key part is encouraging questions. Making it clear that patients and families can ask whatever is on their minds, no matter how tough or uncomfortable those questions might seem.
It's about recognizing that they're going through something incredibly difficult and that they deserve clear, honest answers.
Exactly. And it's not just about answering, it's about helping them understand their choices for care, laying out the potential good and bad of different options so they can make informed decisions that fit with their goals, their priorities.
Recognizing that there's no one right way to do things. The best path is going to depend on the individual's values, their preferences, and how long they're expected to live.
You got it. Now, this whole process of talking and making decisions, it often comes down to something called goals of care. And Dr. Riaz says these goals should be tailored to the patient, realistic, connected to their life expectancy, and driven by what the patient wants and values.
So it's a team effort, right?
Yeah.
The patient, their family, the healthcare team, all working together to come up with a care plan that feels right for everyone.
Exactly. And it's important to remember that goals of care, they can change. As the patient's condition changes or as their priorities shift, it's not about setting a plan in stone and sticking to it no matter what. It's about being flexible, adapting to what the person needs as things evolve.
It's about honoring their autonomy, recognizing that they can change their minds about their care at any point.
Exactly. So let's shift gears a little and talk about the benefits of palliative care. Dr. Riaz really spends a lot of time in his presentation outlining what those benefits are for both patients and their families.
I'd love to hear what he highlights. I mean, we've talked about the overall benefits of a holistic approach to care, but what are some of the specific ways palliative care can improve someone's experience?
Well, for patients, he emphasizes that it can help them find the strength and peace of mind to keep going with their daily lives. It can make it easier for them to handle medical treatments, understand their options better, and really empower them to live their lives as fully as possible, even when they're dealing with a serious illness.
It's about giving them the support and resources they need to navigate the challenges of their illness and keep a sense of normalcy and control.
Right. And for families, he talks about how palliative care helps them understand what's going on, gives them guidance, and helps them cope with all the difficult emotions that come with serious illness. It provides support as they care for their loved one, and it can even make the burden of caregiving a little lighter, create a more peaceful and supportive environment for everyone involved.
It's about recognizing that the family is going through this too. They need support just as much as the patient.
Absolutely. Now, remember those 5 L's of transformation that Dr. Riaz talks about at the end of his presentation? I think this is the perfect time to dig into those a little bit.
I'm ready. He tells his audience to change their lives
Yeah.
by embracing these 5 L's, but he doesn't really explain what they are. What do you think they stand for?
I think it's really clever that he leaves them open to interpretation. It lets each person connect with them in a way that makes sense for them. But based on everything he's talked about, I think they represent a way to live a more intentional and fulfilling life, even when you're facing tough times.
So it's not just about palliative care in the traditional sense. It's about applying these ideas to our lives in general.
Exactly. So the first L, I think it stands for leave. But I don't think he's talking about leaving a physical place. I think it's about leaving behind the things that aren't good for us anymore. Negative thoughts, things we believe that hold us back, unhealthy habits, even relationships that drain our energy. It's about making room for something new and good to come in.
It's about letting go of what's holding us back and being open to growth, to change.
Exactly. The second L, I think that one stands for learn. It's about being curious, being open to new experiences, and always looking for knowledge and understanding. It's recognizing that we can learn throughout our whole lives. There's always something new to discover, even when things are tough.
It's about embracing the unknown and approaching life with a sense of wonder.
Absolutely. Now, the third L, I think this one is about love. Cultivating deep, meaningful connections with people, nurturing those relationships, and expressing love openly and honestly. Recognizing that love can be a powerful force for healing, and it can really get us through difficult times.
It's about putting our relationships first and making time for the people who matter most.
Exactly. The fourth L, I think this one is lift. It's about using our strengths, our talents to make a positive impact on the world around us, lifting other people up and being a part of something bigger than ourselves. It's recognizing that we all have something to offer and that even small acts of kindness can make a real difference.
It's about finding purpose and meaning in helping others and making the world a better place.
Yes. And finally, the fifth L, I think this one stands for live. It's about appreciating each day, being grateful for the simple things, and making the most of the time we have. It's about living in the moment, noticing the beauty around us, and chasing our passions with joy and enthusiasm.
It's about recognizing that life is precious and that we shouldn't take a single moment for granted.
Exactly. So those are my takes on the 5 L's of transformation. Leave, learn, love, lift, and live. They're not just about palliative care. They're about living a more meaningful and fulfilling life, no matter what obstacles we face.
I love that. It's such a powerful framework. And it really highlights the transformative power of palliative care. It's not just about managing symptoms and making someone comfortable. It's about helping people find meaning and purpose in their lives, even when they're facing serious illness.
Right. And I think that's what makes palliative care so special. It's about caring for the whole person, not just the disease.
It's about honoring their humanity and supporting them through their journey, wherever it may lead.
Absolutely. Now, before we head into the last part of our deep dive, I want to throw out a question to you and to everyone listening. How do you think you can apply these 5 L's to your own life? What do you need to leave behind? What new knowledge can you seek out? How can you connect more deeply with people? What are your unique gifts, the things you can use to lift others up? And how can you embrace each day with more gratitude and intention?
Those are powerful questions. I hope everyone listening will take some time to really think about them.
Me too. Because I think that's where the real impact of Dr. Riaz's presentation lies. It's not just about understanding palliative care. It's about using that understanding to change our own lives and the lives of those around us for the better.
It's about embracing a more compassionate, more mindful, and more meaningful way of being in the world.
Exactly.
Back again for the final part of our deep dive into palliative care.
Over the last two parts, we've really gotten to the heart of it, haven't we? It's more than just the medical stuff. It's the emotional, social, even spiritual aspects that make it so powerful. Yeah, it really is a whole other level. And what's really interesting is how all of this connects back to those 5 L's. Remember, leave, learn, love, lift, and live. It's a great way to think about not just dealing with serious illness, but living a more meaningful life in general, no matter what you're facing.
You're right. It's like palliative care, even though it's focused on those dealing with serious illness. It has these lessons for all of us about how to live well.
Totally. And it's not just some vague idea, Dr. Riaz. Throughout his presentation, he uses real-world examples to back it all up. Remember those principles of palliative care he talked about? That caring attitude, respecting individuality, making sure there's informed consent, that open communication. We can apply all of that to our everyday lives, to our relationships, even just how we interact with the world around us.
It's about bringing that same compassion, that understanding, that respect to every interaction we have, whether it's with a loved one dealing with serious illness or just navigating the ups and downs of regular life.
Exactly. And even when we were talking about those specific symptoms like delirium and anorexic cachexia, just understanding those challenges, not just from a medical point of view, but from a human one, it can help us support those who are struggling so much better.
Yeah, it's about remembering there's a person behind the illness,
Right.
understanding their needs, what they prefer, and making sure the care they receive is truly tailored to them and holistic.
And even that discussion about pain management, remember? Dr. Riaz, he talks about regular assessments, sticking to a medication schedule, using non-drug techniques. Those are all principles that can be used for any kind of pain, physical, emotional, spiritual, it doesn't matter.
It's about recognizing that pain is complex. There's so many factors involved,
Yeah.
and so you need a multi-pronged approach to manage it effectively.
Absolutely. Now, before we wrap this up, I want to come back to that question we posed to everyone listening. How can you actually apply those 5 L's to your own life? What things do you need to let go of? What new knowledge can you be seeking out? How can you deepen your connections with the people around you? What unique gifts do you have that you can share to help lift others up? And how can you live each day with more gratitude, more intention?
Those are powerful questions to think about. I hope everyone listening is taking the time to really reflect on them.
I hope so too, because I honestly think that's the real takeaway from Dr. Riaz's presentation. It's not just about understanding palliative care. It's about using that understanding to change our lives
Yeah.
and the lives of those around us for the better.
It's about embracing a way of being in the world that's more compassionate, more mindful, more meaningful.
Couldn't have said it better myself.
Well, this has been an incredibly insightful deep dive, really moving too. I feel like we've covered so much, not just about palliative care itself, but also about how we can live our own lives more fully, more authentically.
I agree. It's been great exploring all of this with you and with everyone listening.
And a huge thank you to London Heartbeats Ache Academy for making this incredible presentation available to us. Everyone should check out all the resources and courses they have. It's an amazing collection.
Yeah, they're fantastic. A great resource for anyone who wants to learn more about healthcare and so much more.
And with that, we'll wrap up this episode of The Deep Dive. We hope you found this exploration of palliative care as insightful and thought-provoking as we have.
And remember, everything we've talked about today, these principles, they apply to all parts of life. So as you go about your day, think about how you can leave behind what's no longer serving you, learn something new, strengthen your connections with others, lift someone up, and really truly embrace the gift of life.
That's a great way to put it. Until